Thank you. So I'll be talking about partnering with hospital administration. I have nothing to disclose. So I'm going to draw on my experience over the past 5 or so years. I've had somewhat of a unique experience. I joined the faculty at the University of Michigan in 2017, and at that time, I came straight out of fellowship, and at that time, the health system was undergoing a process of pursuing a joint venture with another large health system in Southeast Michigan, and there's this opportunity for regional expansion of surgical services to a local community hospital, St. Joseph Mercy Chelsea. And as part of that joint venture with a joint ownership of the hospital, there were a lot of potential leadership opportunities and planning meetings, a lot going into something like a joint venture that offered some opportunity for me to really learn and grow and work collaboratively and partner with hospital administration and leaders in both health systems. And so, I've been blessed and lucky enough to serve in several leadership roles, and all these are different in their own way, but they've all necessitated a really close working relationship with hospital leaders. And I'll draw on some of that experience and what I think are some of the keys to success and strategic priorities when you're working with hospital administrators. So the first is just like anything else, you want to do your homework. You need to plan and really be organized and understand what's your specific ask, what are you trying to achieve, what are your goals, short and long term. So, if you're new to this or, young in your career, certainly consulting with colleagues, people who have been at that institution for a while, mentors that you might have, you really don't know what you don't know. So you really need to do your homework and understand exactly what you're trying to achieve. And then get involved early, establish relationships with people, other physician colleagues, especially those that have been there for a while. I think it's really helpful to learn, staff in the med staff office. They can really help you navigate the local climate of the hospital. Get involved in the local community. It shows your level of commitment to what you're trying to achieve and to offer to the hospital and the surrounding community. And don't be afraid to just start setting up meetings with, nursing leadership, the CMO, CEO, service line chiefs, people that you want to involve in the process and engage closely as you're trying to build a program or introduce a new service line or whatever it might be. And so, one part of that is leading a work group. If you have a specific plan to start a new service, let's say bariatric surgery program, you want to involve all the relevant stakeholders in the process, including the hospital leadership and administrators. So this is just a screenshot of an Excel file that we use to stay organized. If any of you are familiar with the bariatric accreditation process, these are the line items basically in line with the standards manual from MBSA QIP, and that's how we stayed organized with everything. And what you'll notice is we had a very dedicated column to who is the administrative leader who is going to be associated with that line item task for accountability and also for open line of communication. And the names on here are reflective of the CMO, the CEO, the chief financial officer, chief nursing officer. These were all people that were sitting at the table when we were making these decisions about the service line for the hospital. And I felt like that was a very crucial step to achieving our goal of starting a new program. I think it's important to show your value, as other speakers have stated. When you're coming to the table, you want to understand what are the referral patterns, what's the local and regional market, who are the competitors, and how will your program be able to influence that. If you have a business intelligence team, at your disposal, that's a super effective, resource to be able to help targeted approach to outreach, a marketing market assessment, and creating a business plan. And then I also think it's important to have a broader perspective. It's not just about what I need and what you can help me achieve, but what can I offer to the hospital and to the surrounding community? Is there a gap in the type of care that we deliver that we can offer, and do our goals align in terms of strategic priorities. And the other thing is that it's been clearly demonstrated that a better patient experience is associated with an increased profitability of the hospital. So that's a really strong argument when you're trying to ask for resources that, we can develop a system where we deliver safe, quality surgical care, and that's going to, obviously be associated with good financial performance. And then the last few things are, I think it's absolutely important to start smart and start safe. So when you're developing a program, your initial outcomes and that first impression is so important. So, patient selection, types of acuity and complexity of the cases that you're starting out with, make all the difference. And so keep that in mind when you're scheduling your first few cases. Circle back with hospital leaders. You'd be surprised that they're actually invested in, and want to be engaged in how your program or service line is developing. So if you're involved in any quality improvement collaboratives or initiatives, you can share some of those outcomes in quarterly reports. Keep them informed with quarterly meetings or semi-annual meetings about your report and your volumes and outcomes. And then, like with anything else, you want to build a strong team, a culture that's inclusive and resilient. Obviously, treat people with respect and maintain a sense of humility. I think that goes a really long way. So I found this quote. It's from John Harrells, former chief administrative officer for Mayo Clinic, and he said that physicians are responsible and accountable for the success of the institution. Administrators are responsible and accountable to our physician colleagues to help make that happen. And I think in many ways that's true. Obviously, there's some barriers that sometimes come into play. I asked our CEO and CMO of our hospital, community hospital, about their perspective on this, and there are obviously some common themes that they both shared. It's important to be very transparent about what the strategic priorities are for the hospital and how your goals align with that. I think it's important to have very clear and concise roles and descriptions of what everyone's expectations are. Avoiding vague swim lanes is something our CEO emphasized, which is really important. Sometimes, you're brought to the table and you think you have this very strong decision-making authority on something when in fact they're just gathering opinions, and that may be a source of obviously dissatisfaction if you don't have as much of a say as you think you do. And then things like the MEC, which is a med staff governing body versus a hospital appointed position that rolls up to hospital administrators, having that distinction and understanding of the reporting structure is important. From a CMO's perspective, they again had a lot of the same points. Physician engagement is something that they felt was really crucial. Making sure that all the relevant stakeholders are brought to the table and that their voices are heard. And then growth and innovation is important. When you build a program or start something new, you don't want to just plan for a static state. You want to plan for future goals and be able to adapt and evolve with time. So that I thought that was another important point. And just wrapping up, just as others have stated, the best advice I received was obviously be prepared and do your homework and really know your value. And what I wish I knew earlier was who's really making the decisions, because that can really help to focus your conversations and more efficient communications with the people that need to be involved in the conversations. Thanks so much.